Did you know that depression can lead to psychosis? In some of my recent videos on psychosis, people have been asking how that happens. How is it that someone can be depressed and then wind up psychotic? To understand this, we have to think about one of the core features of depression, which I call a negative cognitive appraisal bias. Other people refer to this as depressive cognitions. So when a person is depressed, apart from feeling bad, they might start having very negative thoughts about themselves, but also really negative interpretations of the world around them. Anything that happens, they might interpret as something that's bad, something that they're at fault for, or something that proves their culpability or worthlessness. In mild to moderate depression, a person still retains some ability to test reality around that. So even though they might feel that way, they might think that about themselves, when they're confronted with disconfirmatory evidence, they can push back a little bit on those thoughts. But in very severe depression, it can get so bad that the person loses the ability to test reality around those thoughts. They might become 100% convinced that they are absolutely at fault, absolutely culpable, absolutely whatever the negative thought is. Oftentimes, this becomes themed on parts of their body being diseased, or that they are ill, or that they are somehow contaminated. Other times, it's this intense conviction that they have done something horrible and wrong, even though there is no evidence that anybody can present them with that supports that supposition. Were that to happen, a psychiatrist would term that depression with psychotic features. Oftentimes, this requires broadening treatment from therapy and SSRIs or SNRIs, standard antidepressant treatment, to treatment for psychosis as well. Treatments like Symbyax, which is a combination of olanzapine and fluoxetine, or our most effective treatment for psychotic depression, which is electroconvulsive therapy. Depression with psychotic features can be remarkably frightening to go through, both for the patient and for the loved ones. And it's remarkably challenging to treat. Whether you're a clinician, a patient, or a family member, if you have firsthand experience with psychotic depression, please share in the comments. This isn't spoken about enough, and I think people are suffering and slipping through the cracks. By having these conversations, we are advocating for greater awareness and making it easier for people to reach out for help when they need it. As always, I look forward to learning from each of you in the comments.